Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 30 practice questions. Without the way, let's get started.
Which instructions should the nurse include when providing discharge instructions to a client diagnosed with peripheral arterial disease? 1. Encourage the client to use a heating pad on the lower extremities. 2. Demonstrate to the client the correct way to apply an elastic support hose. 3. Instruct the client to walk daily for at least 30 minutes. 4. Tell the client to check both feet for red areas at least once a week. The correct answer is 3. Instruct the client to walk daily for at least 30 minutes. Walking promotes the development of collateral circulation to ischemic tissue and slows the process of atherosclerosis. External heating devices are avoided to reduce the risk of burns. An elastic support hose reduces the circulation to the skin and are avoided. The feet must be checked daily, not weekly. The nurse is teaching a class on arterial essential hypertension. Which modifiable risk factors would the nurse include when preparing this presentation? 1. Include information on retinopathy and nephropathy. 2. Discuss sedentary lifestyle and smoking cessation. 3. Include discussions on family history and gender. 4. Provide information on a low-fiber and high-salt diet. The correct answer is 2. Discuss sedentary lifestyle and smoking cessation. Remember to look at the adjectives. The stem of the question is asking about modifiable risk factors. A sedentary lifestyle is discouraged in clients with hypertension. Daily isotonic exercises are recommended. Smoking increases the atherosclerotic process in vessels, causes vasoconstriction of vessels, and adheres to hemoglobin, decreasing oxygen levels. Retinopathy and nephropathy are complications of uncontrolled hypertension, not modifiable risk factors. Family history and gender are non-modifiable risk factors. The question is asking for information on modifiable risk factors. A low-salt diet is recommended because increased salt intake causes water retention, which increases the workload of the heart. A high-fiber diet is recommended because it helps decrease cholesterol levels. The client diagnosed with essential hypertension asks the nurse, "I don't know why the doctor is worried about my blood pressure. I feel just great." Which statement by the nurse would be the most appropriate response? 1. Damage can be occurring to your heart and kidneys even if you feel great. 2. Unless you have a headache, your blood pressure is probably within normal limits. 3. When was the last time you saw your doctor? Does he know you are feeling great? 4. Your blood pressure reflects how well your heart is working. The correct answer is 1. Damage can be occurring to your heart and kidneys even if you feel great. You should select the option that provides the client with correct information in a non-threatening, non-judgmental approach. Even if the client feels great, the blood pressure can be elevated, causing damage to the heart, kidney, and blood vessels. A headache may indicate an elevated blood pressure, but the client with essential hypertension can be asymptomatic and still have a very high blood pressure reading. This response does not answer the client's question as to why the doctor is worried about the client's blood pressure. The blood pressure does not necessarily reflect how well the heart is working. Many other diagnostic tests assess how well the heart is working, including an electrocardiogram, an ultrasound, and a chest X-ray. The nurse is teaching the dietary approaches to stop hypertension diet to a client diagnosed with essential hypertension. Which statement indicates that the client understands teaching concerning the DASH diet? 1. I should eat at least 4 to 5 servings of vegetables a day. 2. I should eat meat that has a lot of white streaks in it. 3. I should drink no more than 2 glasses of whole milk a day. 4. I should decrease my grain intake to no more than twice a week. The correct answer is 1. I should eat at least 4 to 5 servings of vegetables a day. The DASH diet has proved beneficial in lowering blood pressure. It recommends eating a diet high in vegetables and fruits. The DASH diet recommends 2 or fewer servings of lean meats, which have very few white streaks. The white streaks indicate the meat is high in fat. The DASH diet recommends 2 to 3 servings of non-fat or low-fat milk, not whole milk. The DASH diet recommends 7 to 8 servings of grain a day. The nurse just received the AM shift report. Which client should the nurse assess first? 1. The client diagnosed with coronary artery disease who has a BP of 170/100. 2. The client diagnosed with deep vein thrombosis who is complaining of chest pain. 3. The client diagnosed with pneumonia who has a pulse oximeter reading of 98%. 4. The client diagnosed with ulcerative colitis who has non-bloody diarrhea. The correct answer is 2. The client diagnosed with deep vein thrombosis who is complaining of chest pain. The chest pain could be a pulmonary embolus secondary to deep vein thrombosis and requires immediate intervention by the nurse. The blood pressure in option 1 is elevated, but it is not life-threatening. A pulse oximeter reading of greater than 93% is within normal limits. Non-bloody diarrhea is an expected sign of ulcerative colitis and would not require immediate intervention by the nurse. The nurse is administering a beta blocker to the client diagnosed with essential hypertension. Which intervention should the nurse implement? 1. Notify the healthcare provider if the potassium level is 3.8 milliequivalents per liter. 2. Question administering the medication if the BP is less than 90/60. 3. Do not administer the medication if the client's radial pulse is greater than 100 beats per minute. 4. Monitor the client's BP while he or she is lying, standing, and sitting. The correct answer is 2. Question administering the medication if the BP is less than 90/60. The nurse should question administering the beta blocker if the BP is low because this medication will cause the blood pressure to drop even lower, leading to hypotension. The potassium level is within normal limits, and it is not usually checked prior to administering beta blockers. The nurse would not administer the medication if the apical pulse were less than 60 beats per minute. The nurse needs to assess the blood pressure only once prior to administering the medication. The nurse is teaching the client recently diagnosed with essential hypertension. Which instruction should the nurse provide when discussing exercise? 1. Walk at least 30 minutes a day on flat surfaces. 2. Perform light weightlifting 3 times a week. 3. Recommend high-level aerobics daily. 4. Encourage the client to swim laps once a week. The correct answer is 1. Walk at least 30 minutes a day on flat surfaces. Walking 30 to 45 minutes a day will help to reduce blood pressure, weight, and stress, and will increase a feeling of overall well-being. Isometric exercises should be discouraged because performing them can raise the systolic blood pressure. The client should walk, cycle, jog, or swim daily, but high-level aerobic exercise may increase the client's blood pressure. Swimming laps is recommended, but it should be daily, not once a week. The client diagnosed with rule-out myocardial infarction is experiencing chest pain while walking to the bathroom. Which action should the nurse implement first? 1. Administer sublingual nitroglycerin. 2. Obtain a stat electrocardiogram. 3. Have the client sit down immediately. 4. Assess the client's vital signs. The correct answer is 3. Have the client sit down immediately. Stopping all activity will decrease the need of the myocardium for oxygen and may help decrease the chest pain. The nurse must assume the chest pain is secondary to decreased oxygen to the myocardium and administer a sublingual nitroglycerin tablet, which is a coronary vasodilator, but this is not the first action. An ECG should be ordered, but it is not the first intervention. Assessment is often the first nursing intervention, but when the client has chest pain and a possible MI, the nurse must first take care of the client. Taking vital signs would not help relieve chest pain. Whenever you want to select an assessment intervention, be sure to think about whether that intervention will help the client, especially if the client is experiencing pain. Do not automatically select the answer option that is assessment. Which cardiac enzyme would the nurse expect to elevate first in a client diagnosed with a myocardial infarction? 1. Creatine kinase. 2. Lactate dehydrogenase. 3. Troponin. 4. White blood cells. The correct answer is 3. Troponin. Troponin is the enzyme that elevates within 1 to 2 hours. CPK-MB elevates in 12 to 24 hours. LDH elevates in 24 to 36 hours. White blood cells elevate as a result of necrotic tissue, but this is not a cardiac enzyme. You should be aware of the words cardiac enzyme, which would eliminate option 4 as a possible answer. The word in the stem is first. This question requires you to have knowledge of laboratory values. The client diagnosed with congestive heart failure is complaining of leg cramps at night. Which nursing interventions should be implemented? 1. Check the client for peripheral edema and make sure the client takes a diuretic early in the day. 2. Monitor the client's potassium level and assess the client's intake of bananas and orange juice. 3. Determine if the client has gained weight and instruct the client to keep the legs elevated. 4. Instruct the client to ambulate frequently and perform calf muscle stretching exercises daily. The correct answer is 2. Monitor the client's potassium level and assess the client's intake of bananas and orange juice. The most probable cause of the leg cramping is potassium excretion as a result of diuretic medication. Bananas and orange juice are foods that are high in potassium. The client with peripheral edema will experience calf tightness but would not have leg cramping, which is the result of low potassium levels. The timing of the diuretic will not change the side effect of leg cramping resulting from low potassium levels. Weight gain is monitored in clients with CHF, and elevating the legs would decrease peripheral edema by increasing the rate of return to the central circulation, but these interventions would not help with leg cramps. Ambulating frequently and performing leg stretching exercises will not be effective in alleviating leg cramps. The nurse and an unlicensed assistive personnel are caring for 4 clients on a telemetry unit. Which nursing task would be best for the nurse to delegate to the UAP? 1. Assist the client to go down to the smoking area for a cigarette. 2. Transport the client to the intensive care unit via a stretcher. 3. Provide the client going home discharge teaching instructions. 4. Help position the client who is having a portable X-ray done. The correct answer is 4. Help position the client who is having a portable X-ray done. The UAP can assist the X-ray technician in positioning the client for the portable X-ray. This does not require clinical judgment. Allowing the UAP to take a client down to smoke is not supportive of the medical treatment regimen that discourages smoking. The client going to the ICU would be unstable, and the nurse should not delegate to a UAP any nursing task that involves an unstable client. The nurse cannot delegate teaching. You must be knowledgeable about the individual state's Nurse Practice Act regarding what a nurse may delegate to unlicensed assistive personnel. Generally, the answer options that require a higher level of knowledge or ability are reserved for licensed staff. The healthcare provider has ordered an angiotensin-converting enzyme inhibitor for the client diagnosed with congestive heart failure. Which discharge instructions should the nurse include? 1. Instruct the client to take a cough suppressant if a cough develops. 2. Teach the client how to prevent orthostatic hypotension. 3. Encourage the client to eat bananas to increase potassium level. 4. Explain the importance of taking the medication with food. The correct answer is 2. Teach the client how to prevent orthostatic hypotension. Orthostatic hypotension may occur with ACE inhibitors as a result of vasodilation. Therefore, the nurse should instruct the client to rise slowly and sit on the side of the bed until equilibrium is restored. If a cough develops, the client should notify the healthcare provider because this is an adverse reaction, and the HCP will discontinue the medication. ACE inhibitors may cause the client to retain potassium. Therefore, the client should not increase potassium intake. An ACE inhibitor should be taken 1 hour before meals or 2 hours after a meal to increase absorption of the medication. The nurse is assessing the client diagnosed with congestive heart failure. Which signs and symptoms would indicate that the medical treatment has been effective? 1. The client's peripheral pitting edema has gone from 3+ to 4+. 2. The client is able to take the radial pulse accurately. 3. The client is able to perform ADLs without dyspnea. 4. The client has minimal jugular vein distension. The correct answer is 3. The client is able to perform ADLs without dyspnea. Being able to perform activities of daily living without shortness of breath would indicate the client's condition is improving. The client's heart is a more effective pump and can oxygenate the body better without increasing fluid in the lungs. Pitting edema changing from 3+ to 4+ indicates a worsening of the CHF. The client's ability to take the radial pulse would evaluate teaching, not medical treatment. Any jugular vein distension indicates that the right side of the heart is failing, which would not indicate effective medical treatment. When asked to determine whether treatment is effective, the test taker must know the signs and symptoms of the disease being treated. An improvement in the signs and symptoms indicates effective treatment. The nurse is developing a discharge teaching plan for the client diagnosed with congestive heart failure. Which interventions should be included in the plan? Select all that apply. 1. Notify healthcare provider of a weight gain of more than 1 pound in a week. 2. Teach client how to count the radial pulse when taking digoxin, a cardiac glycoside. 3. Instruct client to remove the salt shaker from the dinner table. 4. Encourage client to monitor urine output for change in color to become dark. 5. Discuss the importance of taking the loop diuretic furosemide at bedtime. The correct answers are 2. Teach client how to count the radial pulse when taking digoxin, a cardiac glycoside, and 3. Instruct client to remove the salt shaker from the dinner table. The client should not take digoxin if the radial pulse is less than 60. The client should be on a low-sodium diet to prevent water retention. The client should notify the HCP of weight gain of more than 2 or 3 pounds in one day. The color of the urine should not change to a dark color. If anything, it might become lighter, and the amount will increase with diuretics. Instruct the client to take the diuretic in the morning to prevent nocturia. The client is admitted to the telemetry unit diagnosed with acute exacerbation of congestive heart failure. Which signs and symptoms would the nurse expect to find when assessing this client? 1. Apical pulse rate of 110 and 4+ pitting edema of feet. 2. Thick white sputum and crackles that clear with cough. 3. The client sleeping with no pillow and eupnea. 4. Radial pulse rate of 90 and capillary refill time less than 3 seconds. The correct answer is 1. Apical pulse rate of 110 and 4+ pitting edema of feet. The client with congestive heart failure would exhibit tachycardia, dependent edema, fatigue, third heart sounds, lung congestion, and change in mental status. The client usually has pink frothy sputum and crackles that do not clear with coughing. The client would report sleeping on at least 2 pillows, if not sleeping in an upright position, and labored breathing, not eupnea, which means normal breathing. In a client diagnosed with heart failure, the apical pulse, not the radial pulse, is the best place to assess the cardiac status. In option 3, the word no is an absolute term, and usually absolutes, such as no, never, always, and only, are incorrect because there is no room for any other possible answer. If you're looking for abnormal data, then you should exclude the options that have normal values in them, such as eupnea, pulse rate of 90, and capillary refill time less than 3 seconds. The nurse is teaching the client diagnosed with arterial occlusive disease. Which interventions should the nurse include in the teaching? Select all that apply. 1. Wash legs and feet daily in warm water. 2. Apply moisturizing cream to the feet. 3. Buy shoes in the morning hours only. 4. Do not wear any type of knee stocking. 5. Wear clean white cotton socks. The correct answers are 1. Wash legs and feet daily in warm water. 2. Apply moisturizing cream to the feet. 4. Do not wear any type of knee stocking. And 5. Wear clean white cotton socks. Cold water causes vasoconstriction, and hot water may burn the client's feet. Therefore, warm water should be recommended. Moisturizing prevents drying of the feet. Option 4 will further decrease circulation to the legs. Colored socks have dye, and dirty socks may cause foot irritation that may lead to breaks in the skin. Option 3 could be eliminated as a correct answer right off the bat because of the word only, which is an absolute word. There are very few absolutes in healthcare. The client comes to the clinic complaining of muscle cramping and pain in both legs when walking for short periods of time. Which medical term would the nurse document in the client's record? 1. Peripheral vascular disease. 2. Intermittent claudication. 3. Deep vein thrombosis. 4. Dependent rubor. The correct answer is 2. Intermittent claudication. Intermittent claudication is the classic symptom of arterial occlusive disease. The test taker could eliminate options 1 and 3 as possible answers if the words medical term were noted. Both options 1 and 3 are disease processes, not medical terms. Peripheral vascular disease is a broad term that encompasses both venous and arterial peripheral problems of the lower extremities. Deep vein thrombosis is characterized by calf tenderness, calf edema, and a positive Hohmann's sign. Dependent rubor is a sign of arterial occlusive disease. The legs are pale when elevated, but are dark red when in the dependent position. Which individual is at greatest risk for developing hypertension? 1. 45-year-old African American attorney. 2. 60-year-old Asian American shop owner. 3. 40-year-old Caucasian nurse. 4. 55-year-old Hispanic teacher. The correct answer is 1. 45-year-old African American attorney. African Americans have a higher risk of developing hypertension compared to other ethnic groups. This is due to genetic factors and higher prevalence of risk factors such as obesity and diabetes within this population. Additionally, age is a risk factor for hypertension, with the risk increasing as individuals get older. Therefore, the 45-year-old African American attorney is at the greatest risk for developing hypertension compared to the other individuals mentioned. The client diagnosed with essential hypertension is taking a loop diuretic daily. Which assessment data would require immediate intervention by the nurse? 1. The telemetry reads normal sinus rhythm. 2. The client has a weight gain of 2 kilograms within 1 to 2 days. 3. The client's blood pressure is 148/92. 4. The client's serum potassium level is 4.5 milliequivalents per liter. The correct answer is 2. The client has a weight gain of 2 kilograms within 1 to 2 days. Rapid weight gain, for example, 2 kilograms in 1 to 2 days, indicates that the loop diuretic is not working effectively. 2 kilograms equals 4.4 pounds. 1 liter of fluid weighs 1 kilogram. Normal sinus rhythm indicates that the client's heart is working normally. The blood pressure in option 3 is not life-threateningly high and does not require immediate intervention. Loop diuretics cause an increase in potassium excretion in the urine. Therefore, the potassium level should be assessed, but 4.5 milliequivalents per liter is within normal limits. The phrase, requires immediate intervention, should make you think that the correct answer will be abnormal assessment data, data that require medical intervention, or are life-threatening. The client diagnosed with essential hypertension asks the nurse, "Why do I have high blood pressure?" Which response by the nurse would be most appropriate? 1. You probably have some type of kidney disease that causes the high BP. 2. More than likely you have had a diet high in salt, fat, and cholesterol. 3. There is no specific cause for hypertension, but there are many known risk factors. 4. You are concerned that you have high blood pressure. Let's sit down and talk. The correct answer is 3. There is no specific cause for hypertension, but there are many known risk factors. There is no known cause for essential hypertension, but many factors, both modifiable and non-modifiable, are risk factors for essential hypertension. Kidney disease leads to secondary hypertension. Secondary hypertension is elevated blood pressure resulting from an identifiable underlying process. A high salt, high fat, high cholesterol diet is a risk factor for essential hypertension, but it is not the only cause. Therefore, option 2 would be an incorrect answer. Option 4 is a therapeutic reply that is inappropriate because the client needs facts. When clients request information, the exchange should not address emotions. Just facts should be given. Therefore, option 4 can be eliminated as a correct answer. The male client diagnosed with essential hypertension has been prescribed an alpha-adrenergic blocker. Which intervention should the nurse discuss with the client? 1. Eat at least 1 banana a day to help increase the potassium level. 2. Explain that impotence is an expected side effect of the medication. 3. Take the medication on an empty stomach to increase absorption. 4. Change position slowly when going from lying to sitting position. The correct answer is 4. Change position slowly when going from lying to sitting position. Orthostatic hypotension may occur when the blood pressure is decreasing and may lead to dizziness and lightheadedness, so the client should change position slowly. The potassium level is not affected by an alpha-adrenergic blocker. Impotence is a major cause of noncompliance with taking prescribed medications for hypertension in male clients. Noncompliance should be reported to the HCP immediately so the medication can be changed. The medication can be taken on an empty or a full stomach, depending on whether the client becomes nauseated after taking the medication. To answer this question correctly, you should understand the side effects of medications. If you do not know the side effects, you may realize that hypertension is being treated and that hypotension is the opposite of hypertension and might be a complication of treating hypertension. Only option 4 refers to hypotension, providing advice on how to avoid orthostatic hypotension. The healthcare provider prescribes an ACE inhibitor for the client diagnosed with essential hypertension. Which statement is the most appropriate rationale for administering this medication? 1. ACE inhibitors prevent beta receptor stimulation in the heart. 2. This medication blocks the alpha receptors in the vascular smooth muscle. 3. ACE inhibitors prevent vasoconstriction and sodium and water retention. 4. ACE inhibitors decrease blood pressure by relaxing vascular smooth muscle. The correct answer is 3. ACE inhibitors prevent vasoconstriction and sodium and water retention. Angiotensin-converting enzyme inhibitors prevent the conversion of angiotensin I to angiotensin II, and this, in turn, prevents vasoconstriction and sodium and water retention. Beta-adrenergic blocking agents, not ACE inhibitors, prevent the beta receptor stimulation in the heart, which decreases heart rate and cardiac output. Alpha-adrenergic blockers, not ACE inhibitors, block alpha receptors in the vascular smooth muscle, which decreases vasomotor tone and vasoconstriction. Vasodilators, not ACE inhibitors, reduce blood pressure by relaxing vascular smooth muscle, especially in the arterioles. The 66-year-old male client has his blood pressure checked at a health fair. The BP is 168/98. Which action should the nurse implement first? 1. Recommend that the client have his blood pressure checked in 1 month. 2. Instruct the client to see his healthcare provider as soon as possible. 3. Discuss the importance of eating a low-salt, low-fat, low-cholesterol diet. 4. Explain that this BP is within the normal range for an elderly person. The correct answer is 2. Instruct the client to see his healthcare provider as soon as possible. The diastolic blood pressure should be less than 85 according to the American Heart Association. Therefore, this client should see the healthcare provider. This BP is elevated, and the client should have his BP checked frequently, but not before seeking medical treatment. Teaching is important, but the nurse must first make sure the client sees the healthcare provider for a thorough checkup and antihypertensive medication prescription. Diet alone should not be recommended by the nurse. This is not the normal range for an elderly person's blood pressure. The diastolic should be less than 85. Remember, the question asks which action should be implemented first. Therefore, there is more than one answer that is appropriate, but the first to be implemented should be the one that directly affects the client. Along with persistent crushing chest pain, which signs/symptoms would make the nurse think that the client is experiencing a myocardial infarction. 1. Mid-epigastric pain and pyrosis. 2. Diaphoresis and cool clammy skin. 3. Intermittent claudication and pallor. 4. Jugular vein distension and dependent edema. The correct answer is 2. Diaphoresis and cool clammy skin. Diaphoresis is a systemic reaction to the MI. The body vasoconstricts to shunt blood from the periphery to the trunk of the body. This, in turn, leads to cold, clammy skin. Mid-epigastric pain would support a diagnosis of peptic ulcer disease. Pyrosis is belching. Intermittent claudication is leg pain secondary to decreased oxygen to the muscle, and pallor is paleness of the skin as a result of decreased blood supply. Neither is an early sign of MI. Jugular vein distension and dependent edema are signs, symptoms of congestive heart failure, not of MI. The nurse has written an outcome goal, demonstrates tolerance for increased activity for a client diagnosed with congestive heart failure. Which intervention should the nurse implement to assist the client to achieve this outcome? 1. Measure intake and output. 2. Provide 2 grams sodium diet. 3. Weigh client daily. 4. Plan for frequent rest periods. The correct answer is 4. Plan for frequent rest periods. Scheduling activities and rest periods allows the client to participate in his or her own care and addresses the desired outcome. Measuring the intake and output is an appropriate intervention to implement for a client with CHF, but it does not address getting the client to tolerate activity. Dietary sodium is restricted in clients with CHF, but this is an intervention for decreasing fluid volume, not for increasing tolerance for activity. Daily weighing monitors fluid volume status, not activity tolerance. With questions involving nursing diagnoses or goals and outcomes, you should realize that all activities referred to in the answer options may be appropriate for the disease, but may not be specific for the desired outcome. The charge nurse is doing shift assignments for the medical floor. Which client should be assigned to the most experienced nurse? 1. The client diagnosed with congestive heart failure who is being discharged in the morning. 2. The client who is having frequent incontinent liquid bowel movements and vomiting. 3. The client with an apical pulse rate of 116, a respiratory rate of 26, and a blood pressure of 94/62. 4. The client who is complaining of chest pain with inspiration and a non-productive cough. The correct answer is 3. The client with an apical pulse rate of 116, a respiratory rate of 26, and a blood pressure of 94/62. The client in option 3 is exhibiting signs and symptoms of shock, which makes this client the most unstable. An experienced nurse should care for this client. The client in option 1 is stable because discharge is scheduled for the following day. Therefore, this client does not need to be assigned to the most experienced nurse. The client in option 2 is more in need of custodial nursing care than care from the most experienced nurse. Therefore, the charge nurse could assign a less experienced nurse to this client. The complaints in option 4 usually indicate muscular or pleuritic chest pain. Cardiac chest pain does not fluctuate with inspiration. This client does not require the care of an experienced nurse as much as does the client with signs of shock. The nurse on the telemetry unit has just received the AM shift report. Which client should the nurse assess first? 1. The client diagnosed with myocardial infarction who has an audible S3 heart sound. 2. The client diagnosed with congestive heart failure who has 4+ sacral pitting edema. 3. The client diagnosed with pneumonia who has a pulse oximeter reading of 94%. 4. The client with chronic renal failure who has an elevated creatinine level. The correct answer is 1. The client diagnosed with myocardial infarction who has an audible S3 heart sound. An S3 heart sound indicates left ventricular failure, and the nurse must assess this client first because it is an emergency situation. The nurse would expect a client with CHF to have sacral edema of 4+. The client with an S3 would be in a more life-threatening situation. A pulse oximeter reading of greater than 93% is considered normal. An elevated creatinine level is expected in a client diagnosed with chronic renal failure. The nurse is assessing the client diagnosed with congestive heart failure. Which laboratory data would indicate that the client is in severe congestive heart failure? 1. An elevated B-type natriuretic peptide. 2. An elevated creatine kinase. 3. A positive D-dimer. 4. a positive ventilation perfusion scan? The correct answer is 1. An elevated B-type natriuretic peptide. BNP is a specific diagnostic test. Levels higher than normal indicate congestive heart failure, with the higher the number, the more severe the CHF. An elevated CKMB would indicate a myocardial infarction, not severe CHF. CKMB is an isoenzyme. A positive D-dimer would indicate a pulmonary embolus. A positive ventilation perfusion scan would indicate a pulmonary embolus. The nurse enters the room of the client diagnosed with congestive heart failure. The client is lying in bed gasping for breath, is cool and clammy, and has buccal cyanosis. Which intervention would the nurse implement first? 1. Sponge the client's forehead. 2. Obtain a pulse oximetry reading. 3. Take the client's vital signs. 4. Assist the client to a sitting position. The correct answer is 4. Assist the client to a sitting position. The nurse must first put the client in a sitting position to decrease the workload of the heart by decreasing venous return and maximizing lung expansion. Then, the nurse could take vital signs and check the pulse oximeter and then sponge the client's forehead. Sponging the client's forehead would be appropriate, but it is not the first intervention. Obtaining a pulse oximeter reading would be appropriate, but it is not the first intervention. Taking the vital signs would be appropriate, but it is not the first intervention. In a question that asks the nurse to set priorities, all the answer options can be appropriate actions by the nurse for a given situation. You should apply some guidelines or principles, such as Maslow's hierarchy of needs, to determine what will give the client the most immediate assistance. The nurse is developing a nursing care plan for a client diagnosed with congestive heart failure. A nursing diagnosis of decreased cardiac output related to inability of the heart to pump effectively is written. Which short-term goal would be best for the client? The client will 1. Be able to ambulate in the hall by date of discharge. 2. Have an audible S1 and S2 with no S3 heard by end of shift. 3. Turn, cough, and deep breathe every 2 hours. 4. Have a pulse oximeter reading of 98% by day 2 of care. The correct answer is 2. Have an audible S1 and S2 with no S3 heard by end of shift. Audible S1 and S2 sounds are normal for a heart with adequate output. An audible S3 sound might indicate left ventricular failure, which could be life-threatening. Ambulating in the hall by day of discharge would be a more appropriate goal for an activity intolerance nursing diagnosis. Option 3 is a nursing intervention, not a short-term goal for this client. A pulse oximeter reading would be a goal for impaired gas exchange, not for cardiac output. When reading a nursing diagnosis or problem, you must be sure that the answer selected addresses the problem. An answer option may be appropriate care for the disease process, but may not fit with the problem or etiology. Remember, when given an etiology in a nursing diagnosis, the answer will be doing something about the problem. In this question, you should look for an answer that addresses the ability of the heart to pump blood.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.